The topic is how to write a medical research paper, and this is particularly important for Indian population because you must have heard Dr. Vinod Kumar and Dr. Rao talking about the history of diabetes, and as far as India is concerned, uh, unfortunately, though we have had many good researchers and giants in the research, including the people from whom I have learned personally, Dr. Ahuja and Dr. J.S. Bajaj, uh, very few uh, are there considering the number of physicians who are practicing in this area. So I would say out of 100 physicians, only 2 or 3 are actually doing the research. And out of these 3 and so, only one would know how to write a medical research paper. This is something which needs to improve. And especially this lecture is directed towards those physicians who have either never written paper, want to write the paper, or they have written the paper, or their papers have been rejected, or because they have not written well. Um, this the next 30 minutes, I will try to make a point or two about how to improve your writing, uh, and and also give a little bit of tip as far as medical research is concerned. This presentation has been compiled from multiple sources and my personal experience from the Elsevier website, from a number of papers which have appeared in various journals, including Journal of Clinical and Epidemiology, which actually has a series of 11 papers on writing tip, and it is called Writing Tip Series. This is 2013 Journal of Clinical and Epidemiology series. I'll start with the quote. It is easier to embalm the dead than to write an article about it. Most of the people are, they are hesitant in lifting their pen or maybe lifting their laptop to start writing something. So those who are interested must do the writing themselves and not leave to others, because ultimately that will lead to a number of problems, a number of errors, and the publication in an important or index journal will be problematic. This is the main slide and the summary slide. I have tried to present a summary right in the beginning. The key is to be brief and specific. Unfortunately, we have been taught in, say, MBBS and others to write answers in the longhand and so on. So the papers are written in a manner which is very, very sometimes very long and don't convey anything, and while the same thing can be conveyed briefly. And be very specific without omitting essential details. So please don't repeat. The paper should not have redundancy, ambiguity, and also exaggeration, which, since I am a editor-in-chief of Diabetes and Metabolic Syndrome and associate editor of 2 global journals, I see a lot of exaggeration in the research papers, and especially those coming from India. So let's prepare for writing a paper. Look back into your own research and the research surrounding the area that you are researching. Check the latest research results in the field. Have the findings being verified by appropriate analysis and their significance verified, and best to have a biostatistician along with you to advise you on the analysis part and significance part. And also for method and measurement part. Are the methods and measurements valid and reliable? Can you describe the scope and limitations of the methods? Do your finding tell a nice story, or is your story incomplete? Sometimes story is so much incomplete that actually it doesn't make a story. And will this paper add value to the field? Now, this is last one is least considered, because 95% of the papers which I get, I directly reject, because the paper does not add anything to the field. It is usually a copy of another paper written somewhere or poor copy of that. So you should be very clear as to what type of article you want to submit, and that depends on your data. Also, full length methodology research, which is original article, these have the highest value actually. Once you have a CV, then you have the highest value for original research. And then there are other ways to write: letters and rapid communication, short communication, case studies, case reports have the least value. And nowadays, there is a trend towards review papers and meta-analysis and super meta-analysis. You have to also find audience to the paper. Do you want to reach specialists, multidisciplinary researchers, or a general audience? So a purely clinical paper will actually add value to a general audience, but highly specific paper in very, very specific area will reach a specialist. And then you have to adjust information and writing style accordingly. Journals, even in the similar subject, reach readers with different background, and you must write in the same manner that journal wants if you want to publish in a particular journal. Each journal has its own style. We must read a journal's articles before to get an idea what is accepted. And then, are you reaching an Indian audience? Are you reaching a state audience? Or are you reaching a audience worldwide? This is also very important. Start with a blank piece of paper and write down in any order, all ideas that occur to you concerning the paper. Don't even worry about what order you're writing, what you're writing. Just go on writing that piece of paper and preserve that piece of paper once you're finishing the paper. Because once you start writing and once you're finishing, maybe there's a 3 months interval, and the first piece of paper is most important. And maybe in the final writing, you may have missed something which you have jotted down initially. Look at this. This is Fyodor Dostoevsky's manuscript draft of the Brother Karamazov. Now, this is a world famous novel. Everybody knows that. And look at the way he has written. He has jotted down all thoughts everywhere. Probably nobody else except Dostoevsky can make a head and tail out of this. But he wrote such a wonderful novel that is still today, it is something of an epic. Now, which order to write? Now, people often start writing introduction first, and then method, and then and things like that. But the order you should write is first method. Please finish the methods. Please finish your tables. You must have tables first in front of you once you start writing anything else. So next you write the results. And then discussion and conclusions. Look at this. Methods, result, discussion and conclusion, because discussion and conclusion will depend on your methods and results. And then once you finish that, you write the introduction now. And then finally abstract. Now some people start with abstract. Absolutely incorrect. And finally title. So this is the way you should write any paper. Now, outline for introduction, and you must write in this manner. Why is your research important? What is known about the topic? What is your hypothesis? Now, I don't see hypothesis in 90% of the papers that I receive. I reject that paper or send back to authors. Please state your hypothesis. Then post writing, they start with the hypothesis. But that should be the first one to be done. And what are the objectives? So how do you move into introduction? Move on, establish a research territory, show the general research area is important, central, interesting, problematic in some way, and there are gaps in the research. Gaps in the previous research. That's why you're doing this research. And then you say, this is my objective, this is my hypothesis, and then start with the rest of the paper. Now, introduction, do not cite too many references. Because editors do not like too many citations or references irrelevant to the work. So, relevant references. And do not make inappropriate judgments on your own achievement. We have done excellent work previously, and that's why we are doing this work and things like that. And do not ignore contradictory studies or work by competitors. So they may be having some other results, but please present it there. It is not important not to mix introduction with result, discussion, and conclusion. Often people write the same thing in introduction, same thing in the result, same thing in conclusion, the same thing in discussion. And please avoid novel study, for the first time study, first ever study, paradigm changing study. All this should be avoided. Method section is so important that when I start reading a paper, I start reading the method first. And in this, you must do a number of things. Define the population, define the method of sampling, describe the various instruments that you have used in this particular sampling or research, describe the procedures, time frame. Sometimes I don't even see when the research was performed. When I asked the researcher, when was it? Oh, it was 2014, 2015. So I say, we are not going to publish a 6-year-old study. So they have conveniently forgotten the time frame. Describe analysis plan, approaches to ensure validity and reliability, state any assumptions and scope, and describe the scope and limitations of methodology. Now look at this. This is a paper which we wrote back in 2006 in All India Institute of Medical Sciences. Evaluation of cerebral blood flow by single photon emission computed tomography in young Asian Indians with hypertension. And if you see detailed methodology, patient selection, measurement of blood pressure, there are 10 lines on measurement of blood pressure. Definition of blood pressure, definition of blood sugar, definition of body fat, definition of waist circumference, all are. And then how the SPECT of the brain was performed. Use tables and figures to summarize the data, and do not duplicate data amongst tables, figures, and text. So what happens is that you write that these many people were taken and these many had hypertension and same thing is written in the table and same thing is given in the figure. Absolutely no point in doing that. If you are giving in table figure, which is best to give, then you say there is a high prevalence of hypertension in this population as seen in table 1. And always use graphics to illustrate data. So readers often look at graphics first and many times go no further. So they read abstract, they read the figures and they say, okay, I've read the paper. So the reviewer should be particularly sensitive to inclusion of clear and informative graphics. Now in graphics, often table 1, characteristic of the population. And that's not the way to write. And you write SF there and do not explain what SF means. Skin folds, not explained. Each table, once a person reads that table, must be understandable to that person, even if that person does not go back to the text. So it has to be very clear. Look at this diagram. This pie is, you can say, distribution of population using a pie chart. Well, yes, this pie has been eaten and this pie has not been eaten yet. Simple explanation, self-explanatory. Look at this table of a recent paper, Influence of Polymorphism of these genes on weight loss by diet and exercise intervention. Our paper in European Journal of Clinical Nutrition. Look at this, the table effect of 6 months intervention of diet and lifestyle on various metabolic parameters in overweight, obese subject. Very clear what the population is, what the intervention is. The abbreviations used here on the left side, you can see right here. All abbreviations have been explained. And then what is this column? Baseline, bracket, completers day one, N 90 people, and mean plus standard deviation is given. This is column 1, column 2, column 3, all very well described, and differences. Column 4 is equal to column 2 minus column 3, and so p-value is column 5. In one table, you can see everything. Do not have to go back anywhere. Now look at this diagram. Linagliptin-induced bullous pemphigoid, showing excoriated erosion on lateral side of upper arm in 56-year-old male on linagliptin, described as case 13 in table 1. Very clear. Now, if you go to this, histopathology of this, photograph of full thickness skin biopsy under light microscopy into 40 from bullous lesion lateral side of abdomen after 56-year-old male, described as case 3, etc., etc. Everything absolutely well described. Now, statistics, I'm not going to detail. That itself is one separate lecture, but p-value has to be described in detail, not just p is equal to 0.05, less than 0.05, but is equal to 0.0035, and significant should only be used to describe statistically significant differences. Write all the results in the past tense. Match the results section with methods, so there is no discrepancy. Present finding without interpretation. Don't interpret your results in the result section, and highlight findings from tables and text and not write them again. Summarize your significant finding in first para of discussion. So if I have to read as a referee, if I have to read your paper, I will read your methods, I will see your tables, I will see your abstract, and then I'll go to first para of your discussion and see the summary of your finding. So look at this. Vitamin D supplementation in overweight, obese Asian Indian women with pre-diabetes. We have published this paper, and look at the first para. In this carefully designed randomized controlled trial of 18 months duration, we show significant decrease in following: fasting blood glucose, 2 hours blood glucose, post OGTT, A1C, truncal subcutaneous fat as measured by this, and vitamin D with vitamin D intervention. Further, significant greater number of subjects, etc. So in 4 or 5 lines, you get the whole gist of paper. And then if I have to go further, the CK, what is the significance of skin fold in this, then I'll read the further discussion. Move into discussion. Studies major finding, like I said. Move to compare and contrast your finding with those with other published results. State the limitation, weakness, assumptions of your study, and then summarize the answers to your research question which you first asked. So look at this. Really nice, but there are no limitations. This big, whatever paper. There is some summed up in separate appendix. This is the appendix. Don't do that. Summarize your limitation right in the paper. And so, because otherwise a good referee will always ask, oh, your paper is without, you have to mention these limitations. Then you start mentioning those limitations which you already knew that they existed. How to improve the discussion? Do not, as I said, do not reiterate the results in the discussion. Do not make grand statements. Do not introduce new terms or new findings of your study not previously mentioned in your paper. You start writing with the new term. Be crisp and focus on your findings, and other people's work, whether they are in disagreement with yours, must be mentioned. Always discuss with your colleagues and mentors at least twice. Once at the initial stage and near finishing, how to improve your paper. And each time, if I am revising a paper today, I will read only 3 pages, because I know that after that my mind is saturated. I'm not going to find faults in that. So maybe 2 days later, I will read again. And so always I submit my paper on Mondays. I read everything on weekends. And final draft, I always print the whole paper, and read line by line with a pencil. I mark the problems there or do the corrections. Usual draft revisions are 7 to 10. For multiple author, draft number increase from 10 to 50. For me, I usually have 30 to 50 drafts. And look at this. This is one article, Diabetes in Developing Countries, which was published in Journal of Diabetes. We did 44 reviews. Look at this number of reviews. Now, how to improve language? I'm just going to be very brief about it. Avoid words with same meaning. Look at this sentence. In addition, a systemic analysis of data was also presented. Now, in addition, also similar. It should be after statistical analysis of data, methods were then modified. Avoid using the same descriptive word twice in one sentence. In this paper, a simple methodology for classifying simple composite waste have been proposed. And please don't copy from other sections. Each sentence has to be original. Use short sentences. Avoid circular sentence. Look at this sentence. In order to compare the differences in the two analytic method, the dependent variable was set to consideration in order to determine if changes had occurred. So first, in order is twice in this sentence, meaning is so difficult in the first go. Ensure correct commas and hyphens. Look at this. Calcium regulated transcription. There is no hyphen here. And if you make it hyphen, it is different. It has different meaning. Calcium regulated transcription. And similarly, use of comma to identify biomarkers of prostate cancer. We perform microarray analysis. This comma should not be there. Using custom cDNA arrays. Ensure correct use of which is the most important problem in all papers. Incorrect form. Data were normalized to internal difference housekeeping gene actin, which showed. Correct is data were normalized to internal difference housekeeping gene acting, revealing that. Now, which showed means acting showed, which is wrong. And similar to unbalanced sentences. Expression level of P53 in smokers were compared with non-smokers. No, incorrect. Expression level of P53 in smokers were compared with those in non-smokers. So non-smokers, those in non-smokers, because expression level was compared, not non-smokers. And defined or the non-standard abbreviation right in the first use. Now submitting the paper, writing a convincing cover letter. Look at these two people, young researchers, writing the study you have been waiting for. That is the cover letter. Editor's name, address of journal editor, degree must be mentioned. Briefly describe your research area, why you have written this, what is the audience, what is the novelty of this paper. Do not summarize your manuscript or repeat an abstract. Look at this. This came to my journal. Editor, diabetes metabolic syndrome, clinical research. Sir, this is what we want to submit this. Least impressive. Least impressive. This came to European Journal of Clinical Nutrition. Name of the author, subject. Dear editors of EJCN, we are using high selenium lentil diet because of this and this. There is no knowledge previously, etc., etc. Only thing wrong with this is that the editor's name, Professor R. John, is fictitious. MD, Department of Endocrinology, University of Sheffield, UK. Dear Professor John, this is the way to write a cover letter. And title. Most of the titles are so bad. Look at the left side titles. These are from our papers and very descriptive, very concise, focused. Sodium glucose transporter inhibitors in type 2 diabetes in North India, a 12-month prospective study in real-world setting. Non-alcoholic fatty liver disease in Asian Indians, relationship with insulin resistance, diabetes, cardiovascular risk. Effect of oral cinnamon intervention, metabolic profile, body composition, Asian Indian with metabolic syndrome are random. Everything is depicting what should be known right in the beginning, that there's double-blind randomized, where it has been done, what you are investigating, and things like that. And look at this. Imminent risk of COVID. Imminent? What is imminent risk? In diabetes mellitus and diagnosed diabetes mellitus patients. A terrible title. Is there a need to consider metformin in COVID-19 patient with type 2? Evidence-based case report, as if there is a non-evidence-based case report also. Look at this. Should COVID-19 concern nephrologists? Why and to what extent? Emerging impasse. So multiple questions have been asked. The person is already confused reading this title. What does it mean by this? And then, of course, I have already dealt with what type of journal you should perform. So, for example, BMC Medicine is carrying a focus issue on hepatitis C, and that submission guidelines have to be followed. Unethical submission. In the last couple of minutes, I'll talk about this. Do not submit your manuscript to many journals, and editors will find out. So recently, we accepted an article about COVID-19 from an Indian author. After 4 weeks, we found similar article in another journal by same author. We asked explanation from the author and admonished them. Of course, you have to consult the journal to stick to the correct format. In our journal, this is the format, and you should stick to it. Now, why did the editor reject my paper image? Abstract, badly written with spelling mistake and disorganized cover letter. I have told you, paper, poor research, grammatical language mistake, poor formatting, graphics bad, table disorganized, references badly organized, tables and references missing. Now, seeing this, it takes 2 minutes for me to reject the paper. And subsequent to initially, paper is given to the editor sends for review. And then why did the editor reject the paper afterward? Usually 2 to 3 reviews are involved. Even if one reviewer strongly suggests rejection, the paper is rejected. If both reviewers suggest major revision, editor may reject at this point. If revision is half-hearted, not complete, editor may reject it. Mark errors in grammar, language, formatting continue, and editor rejects. Research misconducts consist of fabrication and falsification of data, plagiarism, violation of ethical and regulatory processes, ghostwriting, and unqualified authorship. I'm not going to deal with everything because that's another lecture. But look at the fraud by so-called great scientists. And there are a number of them, but I have selected some from Indian origin because they were like gods in their own area. Bharat Agarwal, I know him very well. Distinguished professor of cancer research at the University of Texas, MD and Cancer Center, resigned his position after fraud was discovered in 65 papers published by him in the area of curcumin and treatment of cancer. Ranjit Chandra, the god of nutrition research from Canada, father of nutritional immunology, was in 2015 stripped of his Order of Canada membership following accusation of scientific wrongdoing in his research. 2015, Chandra lost a $132 million case against CBC, which in 2006 presented a documentary on which 10 of the Chandra's publications were identified as fraudulent or highly suspicious. And recently, company Surgisphere claimed to have hospital data which is used to support studies of effective hydroxychloroquine in treating COVID-19. And papers in Lancet and New England Journal of Medicine were retracted. So it's a maze of tragedy. It's a temptation. Getting my name in this article would look really good on my CV. Rationalization, it's only a few data points, and those runs were flawed anyway. So you can rationalize anything. Ambition, better the story we can tell, the better a journal we can go for. Group and authority pressure often. The PI's instructions don't exactly match the protocol approved by Ethics Review Board, but she's a senior researcher. Entitlement, I worked so hard for it, I know this work, and I need to get this publication. Deception, I'm sure it would have turned out this way if I had done it. He didn't do it. Incrementalism, if only a single data point I'm excluding and just this much. एक ही बार मैं कर रहा हूं, उसके बाद नहीं करूंगा. Embarrassment. I don't want to look foolish for not knowing how to do it. And a stupid system. It counts more if we divide this manuscript into 3 subsections instead of 1. And that's up, brings up to 2 things: plagiarism, presenting the data of other people without acknowledgement, and copying and paste. And this is a serious offense, lead to rejection, academic charges, and termination of employment. And look at this, in this Iranian study, 13% of the students said they copy a full paper and submit to their professors. And 10% said they buy a full paper from somebody else. Recently, we received a paper. Upon checking with Authenticate, which is a software, we found 57% plagiarism taken from other papers. And this is my final slide. Salami Publication, you have one research and then with slight modification, you produce 10 papers. Yes, it says a trivial observation, but fodder for at least 5 papers. So this is salami, one salami, you cut it, and one study, 4 publication or more, and this is something which is happening also in India. So I thank you, Dr. Manu Chaudhapa, Dr. Ritesh, Banshi Shabu, Dr. Vasant Kumar, everybody in the RSDI for giving me this opportunity. I hope this lecture goes on to improve quality of research papers from India, and we hope a better research is done from improving our papers. Thank you.